Get ready. Come on. Get ready. Hey. Get ready for Betty and Mechelle, Phyllis and Stephanie. There's a new show called Good Grief, Good Gossip, Good God, called it G3. Education, celebration, transparency. There's no subject they won't tackle if it uplifts you and me. Good grief, good gossip, good God, G3.
Hello, my name is Mechelle Porter, and I would like to welcome you to another episode of Good Grief, Good Gossip, and Good Guide. As you see, I am missing my sisters, Miss Betty Baye and Miss Stephanie and Miss Phyllis. I'm giving them a week off so they can get a break, because they gave me a week off last week. But today, I'm excited to celebrate with my beautiful sisters, my nurse sisters, Miss Christy Elliott-Cox and Miss Angelina Strickland. I think it's great that this show is airing this week in celebration of Nurses Week and Nurses Month. I'm going to give a shout out to all of my nursing brothers and sisters. We know it's been a crazy, crazy year with COVID, so we just want to give you a shout out, tell you we appreciate all that you do. We know it has not been easy, and just that we celebrate you this week and this month, as a matter of fact. As you see, and I'm going to let Christy talk a little bit more about that. Angie is participating in what many of you have probably seen on social media if you've been following me, and just it's a new phenomenon that's I think is awesome. I've done it myself several times. It's called an IV hydration, which has vitamins in. I'm going to let Christy explain it more. She can do a much better job of it. But today we're going to talk about G3 healthy tips. We're going to talk about IV hydration, the benefits of it, what it is, educate you on that. I'm going to ask Angie and Christy to just talk about what COVID has been like for them. We're also going to talk about healthy tips, what we need to be doing to be a healthy America, healthy Black people, how to, the things that we need to be doing in our race to make sure that we're healthy, not only just exercising, eating right, things like that, medicines, things of that nature. I'm just going to have them touch on things that they would recommend that we do just to stay healthy overall, as well as some things we probably shouldn't be doing. I want us to talk about the good, the bad, and the ugly as far as our health. So with that being said, I'm going to turn things over to Christy Elliott-Cox. I'm going to let her introduce herself, tell who she is, what she does, tell us a little bit about their business, and then we'll let her go into what Angie's participating in.
All right. Hello, everyone. My name is Christy Elliott-Cox. I am a family nurse practitioner. I have been a family nurse practitioner for 7 years. I've been in the healthcare field for 14 years. I am co-owner of a primary care practice, which is called Strickland, Cox and Associates. This is my partner sitting across from me. So I picked up a new hobby, which is IV hydration. You can take vitamins orally. A lot of people do. They can take them over the counter. Our body produces vitamins. Sometimes we don't absorb vitamins as good as we need to, or we don't eat enough meat or vegetables, so sometimes we don't have enough vitamins and we become deficient. The good thing about the IV hydration is it goes directly into your vein and it goes in the bloodstream, so it bypasses the GI tract, which is the gastrointestinal tract, which is the stomach. A lot of people, when they take vitamins orally, they have issues with their bowels, they feel nauseated, but with this, it basically bypasses your GI tract and it goes directly into your bloodstream. A lot of people get these medications for dehydration, immunity. A lot of people who battle with PMS, so a lot of cramping, you can get medicine for that. If you are an athlete, we have one for recovery for your muscles. We also have Myers therapy, which is kind of for immunity. It gives you all of the vitamins, all of the amino acids. So you can get these treatments once a week. Some people come weekly, some people come bi-weekly, every month, or if you have a big vacation coming, or if you had too much to drink or something like that, you can come and it will hydrate you. So
Great. And I'm going to piggyback on what Christy was just talking about. I've done it with Christy. I've worked 3, 4. I've lost count. I think I have a VIP pass for IV hydration. For me, it's more so the energy.
Right.
And Chrissy will tell you, her and Angie both, everybody is different. It depends on the person. Your energy might kick in right away. Some people might be the next day, but I promise you, every time I've done it, it's like I have this just flow of energy for about a week. So it really just depends on the person, how they react to it. But I love the fact that there's different things. Whether there's a female, and I had a friend who came with me, was dealing with some menstrual cycle issues, and Christy gave her some stuff to help her deal with her cramping. Or I had another friend that she had inflammation going on, so that helped her with the swelling and things of that nature that were going on in her body. So it may not be for you, so I want to say that it's not for everybody. You may like it, but I did want to just let everyone know about it, and so they could see someone that's actually witnessed it being done, learn from Christy the benefits of it as well. As she mentioned, she recommends doing it once a week, but everybody has their own schedule, so I highly recommend consulting with your doctor first.
Absolutely.
So you can determine if it's something that you can try, if it's something for you, or if it's not for you as well. So thank you, Christy, for that introduction. Angie, I'm going to have you introduce yourself, tell us who you are, what you do, and tell us about your businesses as well. And I also want to, as Christy said, they are partners with their primary care physician office, but I want you to talk about that as well as your other business.
Okay. So my name is Dr. Angelina Strickland. I'm a family nurse practitioner. I'm dually certified. I'm a family nurse practitioner, and I'm also a mental health nurse practitioner. As Christy mentioned, me and her are partners in our family practice. We do primary care. So we see kids across the lifespan, but then I also went back and got certified as a psychiatric mental health nurse practitioner. So I do mental health as well. I do a lot of medication management, therapy, and then we also do targeted case management and peer support as well. A lot of us, especially as African Americans, we do not pay attention to our mental health as much. We have learned in church that you pray about it and you let it go, but sometimes you need to pray about it and also do the works with it, because prayer without works is in vain. So we have to make sure that we're putting the work behind it. So sometimes it's simple as just having to go talk to somebody, talk it through, learning some coping skills, but sometimes we need medication management to get us over that hump. So I advocate for all of it. I advocate for talking to a therapist. I advocate for taking medication. So it's not something that once you start taking it, you got to take for the rest of your life. You may need it for that season and then get you over that hump. So that's kind of what I do for Have Hope. The name of our business is Have Hope Counseling and Consulting.
Love it. Okay, and I know we're talking about health, but tell us about your other great project that you have going on, and then we'll piggyback into our health topic today. I just want to make sure we get that on here as well.
I assume you're talking about the campsite.
Yes,
okay.
I am.
So me and a couple of my partners, a couple of my friends, girlfriends, we travel annually. We always travel abroad. So we were thinking, wouldn't it be cool to have something right here in our hometown? All of us are from Kentucky. So in our home state that we can travel to and relax, regenerate, and just socialize with one another. So we're opening up a camping ground. The first one will be in Williamstown, Kentucky, which is about 1.5 miles, 2 miles from the Ark experience. So they have a life-size Ark up there. So we right beside that. And that will be, we did repurposed shipping containers. So we took those shipping containers and we made them into like tiny homes almost. And that's what we're doing. So hopefully it'll be open this summer.
Yay! I'm excited. You all know I am Christy and Angie both know, anybody that knows me, I'm a big proponent of, I want everybody to win.
Yes.
So even though this is our health show, the fact that I have two very smart black business owners sitting on my left and my right, and she has a great venture coming, we're claiming it. I just wanted you all to know, to support them and what's coming and what they're already doing, so we can continue to make sure that we all win, we're all successful in our different ventures. I want to tap into, I love how Angie's talked about mental health. I know we're going to talk about health overall, but the mental health. And I know, let's talk about like what's COVID been like you all for the last year. What do you recommend as far as mental health? Because we all know it's been a struggle.
It has.
I mean, I'll be the first to say it hasn't been easy. Some days have been okay. Other days I'm like, ooh, this is a bit much. And especially in the nursing profession, the medical profession overall. I was literally just talking to somebody today, just because I recruit for nurses as well, in addition to being a nurse. And my nurses are struggling. Like they're quitting because it's a lot. They're tired, and this year has really, it's tapped them out. So to kind of talk about how the last year has been for you all. What do you recommend overall, health-wise, mental health-wise, physical health-wise, just for us, just overall, just health-wise. Just give us some health tips, but we can start by let's talk about mental health and how the last year has been for you all.
So the last year have been, for me, it's been different because not only have you been, we turned into teachers over this
Right.
COVID season. So you had to be, and I love my son dearly. I love my son dearly, but now you are a teacher. You're stuck in the house with your kids 24 hours a day. So some of us are stay-at-home moms because now your work went from going off to the office to now you do it at home. So
Right.
you're stuck in the house. So the rate of child abuse has went up, the rate of domestic violence has went up, suicide, depression, anxiety. So all of our mental health disorders have went up astronomically since COVID has started. So we all need that time to decompress. And as humans, we're social people. So we're at a place where we weren't allowed to go see other people. We weren't allowed to go to Sunday dinners after
Right.
church, or even to have church where we communion at. So that was a big change for a lot of people. So I noticed that a lot of people now that we're getting back out have started talking about their anxiety, their depression, and how they're not coping well with it. So they need that extra little person to talk to outside of their family, and someone to say, I was stressed out, and someone to say, okay, it was okay, let's talk it through. So
Somebody to talk to. And I just want to piggyback on that. There's nothing wrong with getting help.
Absolutely.
There's nothing wrong with asking for somebody for help or going to talk to a therapist. I think in the Black community, it's kind of like, oh, you don't go talk to anybody. You keep it in the house. You don't say anything. And I love how you said that you're really focusing on mental health, because we were brought up that you don't do that. You don't go see a
Absolutely.
therapist, and there's nothing wrong with it. If you are at that breaking point, call somebody. I don't care if you call me, Christy, Andrew. If you're at a point where you feel like, okay, I just can't take anymore, it's too much, pick up a phone and call somebody, and we'll definitely get you the resources you need to get the mental health that you need. Christy, I'm gonna let you kind of touch on how do you feel the last year has been for you, as well as tell me some of the things that you've done healthy-wise or you recommend that we do to deal with the things that we've gone through with COVID.
I kind of want to piggyback on what my partner was saying about mental health, because a lot of times your mental health plays a role in your physical health.
That's true.
A lot of the frontline workers have been working endlessly since COVID. We haven't had a day off, or we don't get to work from home, or we can't work from our computers. We actually have to go in, wear a mask all day, put our lives on the line, come home, try to get clean, and still be the mother, our wife, or whatever we need to do for our family. That's a lot. It's stressful, and a lot of times people don't know what they're feeling, or don't know how to deal with what they're feeling, and then it starts causing physical issues, as in high blood pressure, anxiety, weight gain. A lot of people eat a lot because they're stressed, and depression. So a lot of times physical health plays a part on a lot of times mental health plays a part on the physical health.
True.
So I want to make sure that everyone is actually going to their annual exams. Go get your blood pressure checked.
Yes.
High blood pressure is called the silent killer, which means it has no symptoms. You feel great. You don't have any symptoms, but when you go get checked, then you walk in and your blood pressure is 170 over 90. You're at risk for stroke and heart attack. So with stress and high blood pressure and overweight, then we're at risk for dying. There's a lot of comorbidities that happens when you are overweight and you don't eat well. So for me, I want to say that I kind of just trying to tap into different things. I get overwhelmed and anxious easily. So I try to do imagery or walking or reading, or try to find something that I like to do to keep my mind off of it, because I do healthcare all day long. That's my job. But sometimes you have to redirect your energy and try to do something else to make you happy. So I would just suggest people find something to make them happy or occupy their time, and make sure they're going to their primary care office to get their levels checked.
Great. We're going to wrap up this segment and go to a break, but I just want to repeat what Christy said, and I love that. I think it's great for you all to hear that two nurse practitioners, a nurse sitting, I'm LPN, but in the middle of these two nurse practitioners, we're all telling you, we get stressed, we get tired, we get overwhelmed. So we know and we understand that everybody gets overwhelmed and stressed. So make sure you find those outlets, whether it's reading, whether it's walking, whether it's exercising. Find out what works best for you and use that as your stress reliever. And again, if you need help, we'll make sure contact any of us, and we'll make sure we get you in touch with somebody that can help you get the level of help that you need. After this break, we're going to come back with Angie and Christy, and we're going to talk some more about some G3 healthy tips.
Hi, I'm Dr. Giovanni Rondo, host of Healthy Mind, Body, and Spirit. Welcome to Season 2. We have numerous topics that we'll be talking about this year, including stress, COVID-19 vaccines, depression, high blood pressure, diabetes, and numerous other topics that are pertinent for us, the African American community here in the Kentuckiana area. Be sure to join us every week right here or on demand at ssclivetv.com. SSC Live TV. It's TV our way.
Hi, my name is Mechelle, and I am back with Christy and Angie, and we are talking about G3 healthy tips. If you were with us in the first half of our show, we were talking about mental health and how important it is to maintain your mental health, as well as how your mental health can pour into your physical health, which Christy was talking about. You're checking your blood pressure, little things like that, making sure you're going to your annual checkups, because blood pressure is a silent killer. High blood pressure, and I know that's a big thing in the Black community that we don't check on, just with our diets and stress, and we keep saying, I know I'm bad about that. I'm like, oh, I'm fine, and keep going, and you don't get enough rest, and it can lead to health issues. With that being said, I want us to talk about just some of the things that you all would recommend that we need to be doing on a day-to-day basis, on an annual basis, to stay healthy, to avoid, the heart attacks and strokes and things of that nature. What are some of the things that you would recommend that our audience do to stay healthy?
Exercise is number one. I know sometimes in our community, we don't eat the best of foods. I know we're getting better, we're trying, but we use a lot of seasoning on our food. I know we cook with a lot of margarine and different things like that, which could cause high cholesterol, which could cause elevated blood pressure, which is hypertension, a lot of times which causes us to be overweight. The CDC suggests, and it's not the CDC, I'm sorry.
Keep going.
Sorry. I know we should exercise 150 minutes per week, which is 30 minutes a day, 5 days a week. If you can get the 150 minutes in one day, that's fine, but they suggest you do it 30 days. Sorry.
You're fine.
They suggest you do 30 minutes a day, 5 days a week. So exercise is number one. I also will suggest that our women get mammograms annually, once a year. Go get a mammogram if you're over the age of 40. If you have a history of breast cancer or a family history of breast cancer, start 5 years early. So if you don't have any family history, start at 40. But if your mom, your grandma, your aunt, your brother can't have it. Jesus.
Did you say breast cancer?
Yes.
A man can have it.
Okay.
So
Yeah.
you doing good.
Okay. Then start 5 years early. Start at the age 35 or 5 years prior to the age that your first degree relative
That's good
was
information
diagnosed.
to know, because a lot of people probably don't know how soon they should start based on their family history. So that's very good information.
So that's what I would suggest. And also go and get your cervical smears, which is also known as pap smears. You checking for cervical cancer. So you can get those every 3 to 5 years, depending on your history and depending on if your last results were normal or abnormal.
Okay. Awesome. What would you recommend, Angie?
So just to piggyback off of what Christy said, some of the most simplest things to do is rest. Your body needs to regenerate. So we need.
What's that word? I don't know what that
I
is.
know,
Rest?
meaning-
Well, sleep, huh?
So we should be sleeping at least 8 hours a day. 6 to 8 hours, but 8 hours is optimal. It's what you should be doing. And then drinking just plenty of water. You should be drinking plenty of water, 8 to 10 glasses of water a day. Eating pretty healthy, cutting down on the sodium, decreasing your sodium intake to 1,500 grams. I think it's 1,500 milligrams of sodium per day. So we just need to watch the little things that you do make a big impact on your health. For men, I can't remember if she said the colonoscopies. You should be doing the colonoscopies. And now they recommend for African Americans to start at age 45. So you can do the Cologuard. A lot of men don't want to do the colonoscopy. They don't want to be put to sleep. They don't want that experience. But now they have the Cologuard, and the Cologuard is up to 97% accurate for colon cancer. So that's something else that you can do. You can do the Cologuard, and that's a test that we send to your house. You send to your house, you do the test, and you send it back in. So that's something you can do. So that'll be, so there's no excuse not to do your screenings.
Okay.
So.
That's good. I'd love to hear that. And I'm going to piggyback on what Angie said. I love how she said, get enough sleep, because I am guilty. Look, I'm just going to raise both hands and my feet that I know I'm guilty. It's one of our guests that was on here a couple weeks ago, Jonas, said we work at the gym together, and we were talking about not getting enough sleep. And I'm guilty of the fact that I'll get in the bed, but then I got my laptop over here. I've got something else over here. And I'm bad about that. And she said, Mechelle, you have to be intentional about when you go to bed that you don't take all that stuff to bed with you. Make sure you take that time to turn your brain off, turn the TV off, so your body winds down and that you get the sleep. So I really want to recommend, make sure you're getting enough rest, because that is key, and the water.
Absolutely.
We can never drink enough water at all. Tell me what made you all start your business together. Let's talk about that.
So Christy and I actually met. We worked for another private practice. We worked for another doctor, and we both had said, "Hey, I want to start a business." And then I wanted to go back to school. I wanted to go back and get my doctorate. So I went back to school. Christy actually left the practice that we were at. I was still there. And then when I graduated, I called her and I was like, "All right, I'm ready." And Christy was like, "Well, let's go." And I was like, "Okay." So and I can truly say, like, our partnership has been seamless. Like whatever, like, it's yin and yang. If I don't know how to do it, Christy's like right into it. Like she gets right into it, or something she can't do, I'll get right into it. So so when you find a partner, you got to find somebody to complement you, and that's in every part of life, even work and business, work, and at home.
Personal,
you have to do it in everything. So I really think it was seamless for us to get together. We started 5 years ago and didn't look back, and we actually coming up on our 5-year anniversary this July.
Happy anniversary!
Yeah.
Early anniversary. Now tell them where you all located.
We are at 225 North Clifton Avenue.
I know you all moved from your other location, and I wanted to ask that question because our young boys and girls, I want them to see. Here you have two strong black women that lived out their dream. They have their own business, and you can do whatever you set your mind to. So that's why I wanted to tap into what you're doing, and just to encourage our younger generation that there's things that you can do. Never give up. It's never too late to go back to school. Become a nurse, doctor, whatever you want to be. But it's always possible to happen. Christy, tell our guests a little bit about some of the things that you felt were important during COVID to stay. I know you talked about the rest and the walking and exercise and things of that nature, but not only as we transition, I guess from COVID back to regular world, to our regular life. I know it's stressful, but we want to stay healthy. What can we do just to help us transition not only the mental health, but in the yearly examinations, things of that nature? What are some healthy tips that you would recommend for people just transitioning from COVID back to our semi-normal life?
Absolutely. I will continue to wash your hands.
Yes.
Hand sanitizer is great. It does kill 99% of the germs, but it's nothing like good soap and water. So keep your hands clean, because a lot of times we transfer germs and viruses from touch, from surfaces, from one another. It's on the skin surfaces also. Wear your mask. I know we're tired of them, but a lot of times we do things that we don't realize. We laugh, and sometimes particles from our mouth come out. Sometimes we sneeze or we cough, and that's how the germs are getting transferred. If you have
that's a
any
great
type
tip.
of
That's a great tip.
If you have any type of immuno issues, which could be lupus, could be HIV, or any type of autoimmune issues, or if you have any respiratory issues, I would say make sure that you're safe. If you need to get the vaccine, go ahead and get that. Everybody doesn't want the vaccine, and I think that's a choice. But if you have respiratory issues, or if you're elderly, or if you have autoimmune issues, I will speak to your primary care provider, because you are more at risk for transferring the disease or contracting the disease.
Wonderful. I think those are great tips. Okay, so let's talk about Angie and the IV hydration that's going on. Now, Christy, I know you said you recommend it once a week. How often when they go once a week? I know the answer to this, but tell them about how long it takes.
Okay.
And tell them about where they can contact you to get this, and just because I know you go through, like, you'll talk about their health, health history. I'm sorry, I'm getting tongue-tied here, and which bag that you would recommend for them. But just talk a little bit about how long the whole process takes. And I know you come to people's homes and things of that nature.
So initially, you'll reach out to me by email, and I will contact you back. When I get your information, I will send you out a questionnaire. The questionnaire basically lets me know your health history and if you're a good candidate for it. Everyone's not a good candidate. If you have congestive heart failure, or your heart's not able to pump the fluids throughout your body, I won't do it for you. A lot of people with kidney and liver disease are not a good candidate. And I also don't do pregnant people. You will have to have clearance from your doctor. But once we establish that you're a good candidate, we will decide if I'm going to come to you. So I do make house calls, or you can come to our office. The process takes anywhere from 45 to 60 minutes, but that's including the screening, including putting the IV in. Once the IV is placed, then the drip only takes 35 to 40 minutes, depending on your veins. Some people have small veins, some people have, larger veins.
We won't say any names.
So it just depends, but it can range anywhere from 35 to 45 minutes.
Okay, wonderful. Yeah, I'm Christy's problem child when we do our drips.
Yes, she is.
She always gets stuck twice. We're used to that. Angie, tell them, I know some of our audience, and I hear it all the time, when you go to see the doctor, sometimes you're seeing the nurse practitioner versus a physician. And some people feel like, oh, I want to see the doctor versus the nurse practitioner. I'm like, they can pretty much do the same thing. So tell them a little bit about the difference between the nurse practitioner and seeing the doctor, because some people have a problem with seeing a nurse practitioner versus seeing a doctor. And both of you all are great nurse practitioners, so I want them to know they're in great hands with both of you.
So I think they're in great hands with both of us. I think one of the things to set a nurse practitioner apart from a doctor is we've learned that bedside manner, because that's where we started at. We started at listening to our patients. We started at hearing what's going on with you. And I think we just spend more time on average, just nationally on average, a nurse practitioner spends more time in the room with a patient than a doctor does. So I just think that we are able to sit back, listen to what you're saying, and we react to what you're saying, not by what we think because we see your labs. I want to know what's going on with you and how you feel about it. And we try to make a plan together as opposed to me telling you what you're going to do. So I think that's just one of the differences of seeing a nurse practitioner than a doctor. Of course, they have way more education than we do. They do go to school about 4 years longer than we do. But we can't all do the same things. And if we all know our boundaries. So if you come see me and I don't know what's going on, I definitely will refer you out to a specialist before I try to just guess at what's going on with you. But I think you're in safe hands whenever you see a nurse practitioner.
Okay, I think that's great. Anything you want to piggyback on that, Christy?
Oh, I just agree. I think nurse practitioners are great. But like she said, I think the difference, I applaud physicians. I look up to physicians. I just think my fellow nurse practitioners, sometimes we break it down into layman's terms to where our patient understands what we're talking about. I think a lot of times you have more compliance when a patient actually knows what's going on.
Right, I agree.
So if you tell them this is what's going on, this is the medication you need to take, and this is why, then you usually get a better reception, adherence to it. So that's what I think is the difference. And we take a little bit longer with our patient because we're just used to it. We were nurses, so we've always explained things to our patients.
And I'm sorry, I didn't mean to cut
No,
you off.
that's fine. That's fine.
No, you're doing great. Again, it's no digs against our doctors, but I just know I've heard that several times from people like, oh, if I went to see the nurse practitioner, I wanted to see the doctor instead of the nurse practitioner, and I just want people to know that have comfort in knowing that your nurse practitioners can take very good care of you, but if it's something outside of their boundaries, then they're definitely going to refer you on to a physician as well. I appreciate both of you all being here with me today. I hope that we helped you all to get some additional health tips to help you to transition from COVID back to our semi-normal life. We're going to let Angie finish dripping for the rest of this show, and definitely you can contact Christy if you want to learn more about IV hydration. You can definitely contact them at Strickland, Cox and Associates. Did I say that right?
Absolutely.
For your primary care, they can help you with whatever your needs. And again, as Angie said, they will, if it's not something in their scope, they'll get you to where you need to be. I also want to stress mental health. If there's something that you're struggling with, I know there's a lot going on in our community, a lot going on in our world overall. So it can be overwhelming. I understand. And we're stressed. We're not getting enough rest. We're dealing with the woes of just a lot in the world and a lot on our shoulders, being parents, being teachers when we didn't sign up to be a teacher, because that's not my ministry, but it's been a lot for us. So just reach out and get some help. And like I said, if you need anything, all three of us are here to help you and get the help that you need. With that being said, I'm going to end our show with some good God and some good gossip. From 1 Corinthians 6:19 through 20. See, I'm getting tongue-tied now, Christy. Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own. You are bought at a price. Therefore, honor God with your bodies. I think that goes right in line with our G3 healthy tips. Make sure you're taking care of your bodies. Again, I wanted to give a shout out to all of my nursing brothers and sisters. Happy Nurses Week and Happy Nurses Month. We love and appreciate all that you all do. Join me again next week for another great episode of Good Grief, Good Gossip, Good Guide.